Hi students, welcome to the lecture on thoracic and lumbar vertebrae. Previously I've covered cervical vertebrae, and I just wanted to cover the last part of the vertebral column. So the thoracic vertebrae are designated T1 to T12. Remember that with each section of the vertebral column, cervical, thoracic, lumbar, sacral, and coccygeal, the numbering starts over once you reach that region. So for example, cervical vertebrae, we had C1 through C7. And once we reach the thoracic region, the numbering starts over with T for thoracic, 1 through T12. So T1 through T12, all of these are going to articulate with ribs at facets and demifacets. And for the most part, you can tell by looking at these models the locations of these facets just based on some of the surface features. Typically, the facets are going to be somewhat smooth or slightly concave surfaces that are going to be coming into contact with ribs. And because the thoracic vertebrae basically form the posterior wall of the thoracic cage, they are going to be attaching to the ribs, and they're the only vertebrae that do that. With the thoracic vertebrae, they are going to have a very long and somewhat downward sloping spinous process. So it's going to be kind of shaped like this. And that's going to be in contrast to the somewhat shorter, less downward sloping, and in some cases bifurcated spinous processes of the cervical vertebrae. And it's also going to be different from the lumbar vertebrae, which I'll talk about shortly, but those have a more blunt, hatchet-shaped spinous process. And in this area of the spine, there is quite a bit of movement allowed, just due to the location of articular facets. And that is going to allow for more flexibility and more movement, and it's actually going to assist in the process of changing the volume of our thoracic cage for the purpose of breathing. Okay, so if we're looking at a superior view of a thoracic vertebra, a typical thoracic vertebra, you'll see, of course, the spinous process. That is the bony protuberance that you would feel if you were to run your finger along your back. And all vertebrae are going to have that, with the exception of, say, the first cervical vertebrae. But the shape and size of that spinous process can be a characteristic that will help you determine what section of the vertebral column an individual vertebrae is from. So the spinous process in this case is going to be very long, downward pointing. And that's very characteristic of thoracic vertebrae. You'll also see, of course, the transverse process. You will not see transverse foramina like we do with the cervical vertebrae, so there won't be any holes in these structures. They'll just be a solid projection of bone. The vertebral foramen or vertebral foramina will tend to be somewhat more round instead of triangular like we saw with the cervical vertebrae. And then you will see some facets which are going to serve as points of attachment for ribs. So for example, the transverse costal facet, you can just see that this looks like a somewhat smooth, slightly concave area. That's going to come into contact with the tubercle of the rib. And I'll be talking more about ribs in the next lecture to give you some pointers on how to identify the parts of the ribs. Superior costal facet, that's going to come into contact with the head of the rib. Then, of course, we have the body of the vertebra itself. So anytime you see these somewhat smooth, concave surfaces, that's going to be a clue that that is coming into contact with either another vertebra or a rib as part of this whole structure of the vertebral column. So again, long downward pointing spinous process. generally more round or oval vertebral foramina than what we saw with the cervical vertebra. You're not going to see a bifurcated spinous process, and you're not going to see transverse foramina. And just looking at a couple of thoracic vertebrae articulated with one another, this is essentially how they come together. Again, you're going to see these articular processes, and remember that the term articular basically just means when two bones come together. Okay, so the lumbar vertebrae, these are L1 to L5. These are going to be the most robust of the vertebrae just because they are transmitting, they're carrying more weight from the upper part of the body because they are lower down in the vertebral column. They have short, thick pedicels and laminae. The spinous processes tend to be flat, somewhat hatchet-shaped, sort of a rough knob rather than this sharply downward pointing structure like we saw with the thoracic vertebrae. And the orientation of articular facets in the lumbar vertebrae prevent a lot of movement from occurring. So there's not a lot of rotational movement allowed in this part of the vertebral column. So let's take a look at some of the landmarks here. The vertebral foramen may be somewhat triangular shaped, but the characteristics otherwise are really going to set this apart from any other section of vertebrae. Like I said, this is going to be the most robust, heavy, dense vertebrae of any of the others, any of the other sections of the vertebral column. Spinous process does tend to have this very kind of blunt, hatchet-shaped edge to it. The body is going to be very thick because it is weight-bearing. And you're not going to see as many facets that you saw with the thoracic vertebrae because we don't have any ribs attaching with the lumbar vertebrae. So looking at lumbar vertebrae articulated with one another. So this surface here would be a facet where you have two vertebrae coming together. Okay, the sacrum and the coccyx, these are essentially just fused vertebrae. So the sacrum is kind of an odd-shaped bone. You're not likely to confuse it with any other bone in the body just due to its size and shape. And it's kind of roughly triangular in shape, with the anterior surface basically being concave and the posterior surface of this bone being convex. So the sacrum is comprised of 5 fused vertebrae. They are denoted S1 through S5. It forms the posterior wall of the pelvis. It articulates with lumbar vertebra 5 superiorly and with the auricular surfaces of the hip bones laterally. And we'll talk a little bit more about the features of the hip bones once we start talking about the appendicular skeleton. And then the coccyx, of course, the colloquial term for this is tailbone. Consists of 3 to 5 fused vertebrae, and it articulates superiorly with the sacrum. So this would be an anterior view of both the sacrum and the coccyx. So you can basically see that this ridge is the boundary between individual vertebrae that have fused together. So each of these sections is derived from a vertebra that fused with the one below it. And for the purposes of this course, I do just want you to be able to recognize this as the sacrum and recognize this as the coccyx. We don't have any of the bony landmarks or bone markings on our lecture learning objectives for these two structures. And then this is the posterior view. So the posterior view is basically a convex, has a convex appearance to it with these ridges known as the median sacral crest. And then of course the coccyx, which is the tailbone. And you'll see here, this is the auricular surface. This is where you actually have it articulating with the hip bones. Okay, so this wraps up my coverage of the axial skeleton. I'm going to go ahead and start recording a lecture for the appendicular skeleton. As always, let me know if you have any questions, and thank you for listening.